What if the food you have been eating all your life has been quietly chipping away at your ability to get and stay hard without you even knowing it? I'm Dr. Laura Stone. I'm going to start our countdown with a category that most men have eaten for years without realizing the damage it can do: fried foods loaded with trans fats. When you think about fried foods, you might picture golden fries, crispy fried chicken, mozzarella sticks, or onion rings. They may look harmless, even comforting, but deep down, they're working against you in ways most men never realize. Here's the science in plain terms. Fried foods are loaded with two main troublemakers: trans fats and saturated fats. Trans fats are the worst of the worst. They're artificially created by adding hydrogen to vegetable oils, making them solid at room temperature. This extends shelf life for the food, but shortens the life of your arteries. Trans fats not only raise bad LDL cholesterol, they also lower your good HDL cholesterol, the very type that helps clear plaque from your blood vessels. That double hit makes your arteries stiff, narrow, and inflamed. And because the penile arteries are only about 1 to 2 millimeters wide, they're the first to feel the pinch. But that's not all. Fried foods also impair nitric oxide production. Nitric oxide is your body's chemical signal that tells the smooth muscles in the penis to relax, allowing blood to rush in. Without enough nitric oxide, your blood vessels stay tight and restricted, even when you're aroused. That means less blood flow, weaker firmness, and shorter duration. You don't have to be overweight for fried foods to hurt your erections. Even lean men in their 50s, 60s, and 70s can have significant arterial damage from years of trans fat intake. The body simply can't process and clear these fats effectively, so they linger in the bloodstream, damaging the vessel lining, a process called endothelial dysfunction. And endothelial dysfunction is one of the earliest, most reliable signs of erectile decline. So, if fried foods are the first major culprit, the second one is a close cousin, one you might think of as hearty and masculine, but in excess, it's just as damaging: red and processed meats. We're talking about steaks, burgers, bacon, sausages, hot dogs, the kinds of foods that have been marketed for decades as part of a strong man's diet. But the science tells a different story. These meats are high in saturated fats, which, like trans fats, raise LDL cholesterol and promote arterial plaque buildup. Over time, that plaque acts like a slow-closing valve, restricting blood flow more and more until performance suffers. And research has shown that diets heavy in processed meats are linked not only to heart disease, but also to higher rates of erectile dysfunction, regardless of age. It's not just about the heart. Plaque buildup affects all arteries in the body, and because erectile tissue is so sensitive to changes in blood flow, problems often appear there first, sometimes years before a man is diagnosed with cardiovascular disease. Now, I'm not saying you can never enjoy a steak again. But if red and processed meats are a regular feature in your week, and especially if they're paired with fried foods, you're stacking the deck against your own performance. The third food group that can slowly rob you of strong, lasting erections isn't fried, and it isn't fatty. It's the silent combination of high sodium and added sugars, the invisible enemies of intimate circulation. Let's start with sodium. Salt itself isn't evil. Your body needs a certain amount for nerve and muscle function. But too much, especially from processed and packaged foods, raises your blood pressure. And here's why that matters for erections. Remember, an erection depends on your penile arteries widening enough to let in a surge of blood. If those arteries are rigid and narrow because of years of excess sodium, that widening simply doesn't happen. The result? You get a weaker, less reliable response. Canned soups, frozen dinners, deli meats, bread, and even some breakfast cereals are loaded with it. Now, let's talk about added sugars, because they're just as dangerous, but for different reasons. Excess sugar spikes your blood glucose, which over time causes insulin resistance. That's a state where your body has to pump out more and more insulin just to keep blood sugar in check. This damages blood vessel walls and triggers inflammation, both enemies of healthy erections. High sugar intake is tied directly to poorer erectile function, and not just because of diabetes. Even without full-blown diabetes, frequent sugar spikes weaken the vascular system, reduce nitric oxide levels, and may contribute to nerve damage that affects sensation. And don't be fooled, it's not just candy and desserts. Sugar hides in pasta sauces, salad dressings, flavored yogurts, granola bars, and low-fat products. Think of high sodium and added sugar like a 1-2 punch. Sodium stiffens your arteries. Sugar inflames them. Put the two together in something like a frozen pizza, fast food sandwich, or packaged snack, and you're getting a direct hit to your vascular system every time. So, what's the bonus culprit? It's one you might not think of as a food at all: alcohol. In moderation, some types of alcohol, like red wine, may have neutral or even mild positive effects on vascular health. But heavy, long-term drinking is a different story. It damages the nerves that trigger erections, reduces testosterone levels, and impairs liver function, which can lead to hormonal imbalances. And here's the shocking part. Chronic alcohol overuse can actually cause physical shrinkage of the penis and testicles. That's because alcohol is toxic to the cells in these tissues, and it disrupts the hormonal signals that keep them healthy. If you've ever noticed that after a night of heavy drinking, performance is weaker, that's the short-term effect. But over decades, the long-term impact can be far more permanent. For most men over 60, cutting back on packaged, processed foods and limiting alcohol to no more than a drink a day can make a noticeable difference in circulation and hormonal balance. So, how do you put all this into practice without feeling deprived? Here are a few simple swaps. Trade fried foods for grilled, baked, or air-fried options. Replace red and processed meats with fish, chicken, turkey, or plant-based proteins a few nights a week. Flavor foods with herbs, spices, and citrus instead of excess salt. Satisfy your sweet tooth with fruit instead of packaged snacks. But there's one more piece to the puzzle: what you add to your diet once you've removed the problem foods. Because cutting the bad stuff only gets you halfway there. To actually strengthen erections over time, you need to fuel your body with nutrients that improve blood flow, protect your arteries, and support testosterone naturally. And that's exactly what we'll talk about next, along with a mindset shift that helps men in their 60s, 70s, and beyond enjoy not just better performance, but better overall vitality. Here's where it gets exciting. Research from the Health Professionals Follow-Up Study, which tracked thousands of men over decades, shows that those who followed a Mediterranean-style eating pattern, rich in vegetables, fruits, whole grains, nuts, legumes, lean proteins, and healthy fats like olive oil, had significantly lower risk of erectile dysfunction, even into their 60s, 70s, and beyond. Because this kind of diet fights inflammation, lowers bad cholesterol, and keeps your blood vessels flexible. In other words, it does the exact opposite of what fried foods, processed meats, and added sugars do. Let's not forget the hormone connection. Diet quality directly influences testosterone levels. Poor eating habits raise body fat, which increases an enzyme called aromatase, and that enzyme turns testosterone into estrogen. Lower testosterone means less libido, slower response, and weaker erections. Diets high in processed junk contribute to obesity, metabolic decline, and lower testosterone. The flip side is just as true. Eating nutrient-rich whole foods helps maintain healthier hormone levels naturally. These foods aren't magic pills. They work because they're consistent, daily fuel for your vascular and hormonal systems. Over weeks and months, they help reverse some of the damage caused by years of poor diet. Now, here's the mindset shift I want you to take away. Men in their 60s, 70s, and even 80s are not destined for permanent decline in sexual performance. Yes, aging changes the body, but your diet, activity level, and overall lifestyle can either accelerate decline or slow it dramatically. I've seen patients in their mid-70s who, after making these changes, went from struggling to maintain an erection to enjoying reliable, satisfying intimacy again. The difference wasn't a miracle drug, it was daily, intentional choices. Think about it like a bank account. Every time you eat artery-friendly, nutrient-rich foods, you're making a deposit into your erectile health account. Every time you choose fried, processed, or sugary foods, you're making a withdrawal. Over time, the balance reflects your habits. So, here's the challenge. For the next 4 weeks, reduce or eliminate the major culprits we talked about: fried foods, processed meats, high-sodium packaged snacks, added sugars, and heavy alcohol. Replace them with the kind of meals I just described. Pay attention to your morning erections, your energy, and your mood. Many men start noticing positive changes in as little as a month. And remember, you don't have to be perfect. What matters is tipping the balance toward more deposits than withdrawals. Even a 20 to 30% improvement in diet quality can have measurable effects on blood flow and hormonal health. Every bite you take is either fueling your erections or quietly shrinking them. The choice is yours, starting today. If you found this video helpful, give it a like and subscribe for more medically accurate, no-nonsense tips on men's health over 60. And if you want to know the other side of the equation, the best foods for stronger erections at any age, check out my next video, where we cover exactly which foods build nitric oxide, support testosterone, and help keep your performance strong for years to come. And always remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.